most famous physical therapist on the internet.
And we're back. Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Because we're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So we're going to show you today how to fix shoulder pain in seconds. This works. This is an updated video. We did this one before. We've learned a few more things, Brad. We've become smarter.
Right.
So we're going to add those in. Stay tuned. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Join us at bobandbrad.com because we're always giving something away. I'll show you in a minute what we're giving away. You can also find it on Facebook. We'll be pinned at the top of the page. You want a 60-second version of us, go to Twitter, Instagram, or TikTok. That's the new one. So the thing we're giving away is this Pro-Point. And so what this actually has a little suction cup. You can actually suction to some walls. Definitely to glass, but you don't really want to lean against glass. What's nice about this, you can put it on the floor. You can actually take the suction cup off, lean on it, and it'll actually work on your trigger points. It's just a great way it'll also work on stretching your upper back. We're going to show that.
Plantar fasciitis.
Plantar fasciitis.
You can do some foot pain management with it. So they're nice little
work on my hamstring while I'm on my chair.
There you go.
So,
all stealthy. Very good.
All right, Brad, let's take it away. What are the shoulder things we're doing?
So shoulder pain, very common. And what we found out and what the studies have shown, approximately 80% of shoulder pain is from an impingement issue. We're not going to go into the details of impingement, but all these exercises address impingement.
Yes, they do.
And the success rate is remarkably high. And we found it in the clinic. We get a lot of feedback from people who say, boy, we've done this in the hanging particularly.
Right.
And things are really improving after just a few times.
Yep.
So shall we get on with it?
Yes, let's go.
Again, we're going to show 5 different options. You can try all 5, but only do the ones that give you success. In other words, more range of motion with less pain, or it feels good while you're doing it.
Yep.
Okay? So the first one, very simple, scapular retraction, because it improves the posture. When your posture is good, the shoulder joint works better.
Right. We don't want the shoulders internally rotated with what they often are.
Yep.
We don't want them forward. We want the scapular retraction to put them in the right place, to have that right foundation. So you can see on me when I'm doing it, you want the shoulder blades to come together and even down towards.
Show mine. I show better. I got those white stripes.
Oh, yeah. See how they're coming together?
Right.
But we want the shoulder blades to think about them like you're trying to push them down into your pockets down below.
Right.
So.
And the next thing you can do with that is, if you want to strengthen it, can you come over here, Mike? Use some exercise bands, and it works really well with the wall anchor that we have here. And I'm going to do the same thing, but now with resistance is even a step up with this exercise. So that works really well. You can do a set of 15, 20 of those is a good number to work with.
Speaking of the wall anchor, Brad, why don't we go right into the next one?
Sure. That's right. And now this whole concept of hanging to improve shoulder pain, we actually got from a shoulder surgeon who wrote a book on it, Dr. Kirsch.
Yep, and I'll read the book. It's called Shoulder Pain. I'm not going to read the whole book. It's called Shoulder Pain, The Solution and Prevention. It's 4th edition. He mentions the Kauai study that was on the island of Kauai, where they had really good results from hanging. I mean, they had people that were scheduled for surgery that ended up not having surgery just from hanging.
You can hang from a pull-up bar. Works very well. That's what he does. We actually use the wall hangers. There's a couple advantages with this that you don't get from a pull-up bar. And one is you can really control your intensity of the hang, plus it helps your posture, and it actually gives you some decompression of your spine, which can be real helpful. So I'm just going to demonstrate it quickly here. And he'll recommend up to 30 seconds or even more, depending on how long you can comfortably hang. But actually, for this, if you find this is helpful, you might want to look at our hanging videos where it goes into more detail on how long you can hang.
I do want to point out, Brad, here, again, I don't know if you saw, Brad, he took this comes off here. And what's nice about this with the wall anchor, you can use this for also 4 bands and do your strengthening off the same thing.
Right, and do a scapular traction from a higher level is
so it has multiple uses. It just works out really well.
Yep.
So.
All right, and the next one, the Statue of Liberty. Here,
We can show different ways.
with the
Booyah.
booyah stick.
So you can use a broomstick or anything, a yardstick or something that'll,
It needs to be 4 to 5 feet long. These are 5
Right.
feet long. The bigger diameter makes it much easier to grab, about an inch and a half in diameter.
had some really good luck with this one.
All right.
Yeah.
Yeah.
And what's nice about it is, let's say your arm is quite sore, you can work your way up there, or even use the other arm to help you up. But you can crawl your way up there,
Right.
up the stick.
The idea is you want to get your shoulder up here without pain, so you're going to use the stick to support it.
Well, I've definitely have had people start like down here, Brad, and,
Yep.
and even just do this to start off with,
So
working like this.
That's flexing the
Yep.
arm.
Yep. And then I have them go up further and further to the point where they're actually really leaning into it.
Right.
And it's almost like the hanging, basically.
It is. The concept is the same on the shoulder joint. Once you get up here, you can do it seated like Bob is. You can do it standing on a tabletop. And you get a nice stretch in there. And what's going on is we're actually opening up that gap so the impingement is minimized, or actually is taken away by stretching that a ligament in there. That's all explained in the nice book here.
Now, another one you can do, this is by Brian Mulligan. This is a technique. And you can do this off a countertop or the back of a chair. Kind of the same concept. You're trying to set the head of the humerus down into the socket a little bit.
So our muscle energy is going to pull the head down to where it belongs, so
Yeah.
that you can get range.
So I'm pushing down with my hand into the chair, and I'm pushing down the entire time as I walk away like this. I'm pushing down, I'm pushing down. Now I'm coming back and I'm still pushing down the whole entire time. That's what the exercise is. And I've had some good luck with this one too. It should be pain-free.
Right.
If it hurts, no.
Right.
Don't do it.
Exactly. Typically, you'll find when you do these, you're going to feel it. Like we get feedback from our patients or from viewers that say, boy, this one worked really well. And they know it right away.
Right.
If you do it, it creates sharp pain. It's not the right exercise.
What's nice about these is you can do them throughout the day.
Right.
We're not saying do these once. Same with the hanging, same with the Statue of Liberty. You can do it 5-6 times a day.
Right.
Just take a few seconds and go ahead and stretch it, or take a few minutes.
And with all of these, you're not going to do them 30, 40 times. You're
Right.
just going to do them, maybe starting out with 5 repetitions, probably not more than 10. And then give it a break and come back in a couple hours.
Well, it's got to be less than 60 seconds because we're saying do it in seconds, right, Brad? So
Well, yeah,
I
but
guess you do 100 seconds.
you're not going to hold it for
Right.
for 60 seconds. You'll hold the Statue of Liberty for 5 to 10 seconds,
Right.
and do it 6 times.
Yes, exactly.
So the next one, should we show the famous
Sure.
chicken wing?
Sure.
Bob is the inventor of this.
Well,
one.
I really like this one because it helped me, and
And-
all of a sudden I'll start to feel the pain, and I'll just do this, and it takes it away.
Right.
But I also do the Statue of Liberty, so I'm not sure which one's
one?
doing it. Yeah.
Right.
So I'm going to do it to this left arm right here. Am I on the right way? Because
No, actually, this arm is in the way. It's easier. That's all right.
if I go like
There
this.
you go. Yep.
Okay.
So he's going to be treating his left arm, the one on the bottom.
So this palm is facing out.
Yep.
This palm is facing forward. And as you start, you may not be able to do much more than this. You might only be able to go up and down, but eventually you want to start pulling out a little bit like this too. And I actually pull up and out, and I leverage. I don't hit my head here. I go off the side of my shoulder like
Right.
this, and I stretch it out like this, and it seems to be stretching out the capsule to make a lot of room for it. I was doing everything for my shoulder. It was not taking the pain away.
Sure.
I did this, within days. It was so much better. It was amazing to me.
Right.
I couldn't say enough about it.
And I don't know. I think maybe we should admit the concept that comes from Mackenzie,
Right. Mackenzie,
he's a famous therapist.
he's going into extension. I just added extension and internal rotation.
right.
So kind of doing both at the same time.
And I've just had a couple women that were 65 years and older do this technique with their shoulder just because they couldn't reach behind their back to put their clothing, to dress. And so we wanted to get this range of motion. It was tight. So we would do this.
So they were just doing the up and down.
Just the up and down. You know, they didn't need to do this to get to the level they wanted to.
Yep.
And we found that that worked. They could do it by themselves. It really helps to have a smooth stick so it slides along your clothing.
If you see how when Brad was doing that, how well it was going up and down, you know, without any friction.
Again, these need to be pain-free.
Yes.
When you get it up to where it starts to hurt, then you go back down. The pain-free range might be here, but after about 4 days, you may go up to here without pain, and you're gradually stretching, doing it in an appropriate pain-free manner.
Generally, what you find is that as you improve motion, pain tends to go down.
Right.
That just seems to be the correlation that you'll find.
Be nice to yourself. Listen to your body. Take your time with these, and day by day, things are going to improve.
Does that mean I have to be nice to you too, Brad?
Well, Bob, why, Bob? Why? I don't expect it anymore.
All right. Thanks, everybody, for watching.